Good evening. First of all, I would like to thank the organizers of this Congress and the speakers for the very important information that we're receiving. I have several questions. The patients that have MCS, that can only be diagnosed by an expert in environmental medicine or conventional physicians, so to speak. Do the doctors have sufficient knowledge to be able to diagnose them? Do we have a way of diagnosing these patients, or only and the diagnosis can be made by environmental medicine experts?
Patients can be diagnosed by family doctors that are educated in this, and we have a lot of them that have now in the United States. I don't know about in Spain whether you have enough family doctors that can do this, but certainly the specialists in environmental medicine and the different microcurrents and homeopathy and so on can help with this.
Well, I think that certainly they can. There's a huge literature about environmental impacts on mankind and the illnesses that are caused. But the problem is that there are people who are practicing regulated medicine, shall I say, where they follow guidelines and nothing is personalized. And I think that personalized medicine is what environmental medicine is. Even though we have some patterns that we use, it's still all personalized. It's inadequate for them to consider just guidelines medicine. Do you want to say?
Yeah, I'd only add that I think it is I don't think it's a difficult diagnosis to make, really. I mean, most of the time the patients will tell you the diagnosis, it does take some investigation, it does take a little bit of thought and a few good questions, sometimes for the milder and moderate patients, removing a substance from their environment will make them better, and that really should be the family docs that are doing that. And if you know any family doctors that are interested, any of us would be more than happy to help them be trained in that.
And in the UK, Mr. William Ahern, who's here and who's speaking tomorrow, is happily hoping to organize with us, rather, seminars throughout the year, and we hope that we'll be able to educate more doctors.
Quería añadir también que, bueno.
Allow me to add that we've had some good news. Yesterday, a doctor saw a program and he liked the program and said that if he wanted to organize a course for next year for the primary care doctors, we can provide this information to them. This will give them the opportunity to learn about environmental medicine, and that will be helpful for them in diagnosing this patient. So we should be preparing that now for July, I think, so that we can start in September, October. They want to do that as soon as possible. So there are so many doctors who do not know about environmental medicine. It's not because they're not interested. It's because they don't know about environmental medicine, and that causes suffering to their patients.
Sí, quería hacer una pregunta al doctor.
Question for Dr. Farre. When you irradiate food, can you produce free radicals? Can you use that as an argument to say that irradiated food can be carcinogenic? Irradiation, of course, can release free radicals. If it is ingested, if free radicals ingested per us, they can be neutralized initially, but it's necessary to conduct experiments I am not aware of any experiments that have been conducted in this regard, but at least theoretically, food that is irradiated, well, become denatured. The proteins become denatured, but that will depend also on type of food. Now, if there's a certain amount of water, ionizing irradiation will produce hydrogen peroxide, but it's necessary to conduct experiments and measure that. To my knowledge, there is no experiments have been conducted. I think it's a very important question. Well, first of all, I don't see any reason why food is irradiated. And you see, you have formation of bacterial layers, and their films. When bacteria form films, they have different behavior as compared to when they form colonies. And some have proposed using irradiation to solve that problem of bacterial films. Others prefer to use antibiotics. However, they will cause antibiotic resistance. You'll have antibiotic resistant strains. Microphone, please. Microphone, microphone, microphone. Thank you. I read an article where they described that they were radiating pork. Yes, it's not prohibited. It's not prohibited, but it's not common. Maybe 20 years ago, they spoke a great deal about radiation as a way to preserve food. Irradiation attempts to eliminate bacteria because bacteria still remain a problem, but they've also considered using let's see, chemicals to prevent bacterial proliferation. But that has been a problem in food. But irradiation, as I said, experiments should be conducted first.
There have been a series of studies done on irradiated foods, and they've shown that you get a major depletion of antioxidants. Not surprisingly, if you generate oxidants, you're going to deplete antioxidants. You get a major depletion of many of the vitamins, including the B vitamins. And but the other thing that's disturbing about irradiating foods is that you generate literally tens of thousands of novel compounds in very tiny amounts. And there has been at least one animal study done which shows that animals don't do very well if you feed them irradiated foods. So I personally am very concerned about this, not from the standpoint of carcinogenicity, which you asked about earlier, but simply from the standpoint of the nutritional qualities of the food and the toxicity of these foods. Okay.
Okay. I have a question to Jane Monroe. Hello. You spoke about the sulfation and the detoxification with these function tests.
Yes.
But did you also test for sulfate in the plasma or serum in this patient? Was that low too, or didn't you do that, or maybe part of the patient?
Yes, we did, but not as part of that test. We've done that subsequently. We measure cysteine and sulfate, and often sulfate is low in people who have a deficit of the enzyme called phenol sulfotransferase, which is responsible for making inorganic sulfate from organic compounds. There are two classes of this, and in our chemically sensitive people, it was about 40% of them had a problem with it, whereas it's 2% of the general population. But in those people now, we don't do the whole measurement of the enzymes because it's too expensive for people. We use our knowledge and assume that half of them are going to be definitely short, but we can measure just sulfate, and that's very useful. Thank you.
Thank you. I think another point on this is that we have 3 different intravenous magnesiums: mag chloride, mag sulfate, and mag gluconate. And the reason we do that because some people can tolerate one and they can't tolerate the other, and you can go ahead and give it to them and get their load of magnesium in there.
Hola.
Sí, quítate los cascos para...
No sé a quién va.
I don't know whom to ask. Last year, I spoke about hip prosthesis. I'm from Navarra. After an operation, I developed chemical sensitivity, and now I have also developed EHS. Now in October, I have to undergo another surgical procedure on the other hip. And I had difficulty even going to the train station here in Atocha. And really, after listening to your presentations, I'm rather worried because last year I asked the same question. I spoke about the hip prosthesis, and I don't know what additional information you can give me now. Last year we spoke about chelation, etc.
You're a classic case of what I talked about, and you ought to be tested for the anesthetics because many of our patients react to the anesthetics if you're electrically or chemically sensitive. And generally, we like to avoid the fluorinated hydrocarbons and chlorinated hydrocarbons, use intravenous nutrients or intravenous anesthetics. One's called Versed and the other's called Diprovan. And we can test for those. And you can test for them, can't you, Gene? I think. And that makes your anesthetic much safer. Also, if you have a lower extremity procedure done, you can do a spinal, but you should test on the local anesthetics and have those preservative-free because you may be sensitive to those. And then you should be tested for the prosthetic that's going to be put in and get all the materials for those. So there's something you can do and make your operation much, much safer. Also, it's good to just lower your total pollutant load.
Sí, un momentito, me gustaría intervenir.
Right, I'd like to make some comments. He's a patient of mine. I know about the patient's history. I already spoke to Jean about this last year, precisely, about this patient. Because he developed chemical sensitivity and also electrosensitivity, MCS and EHS. And he received immunotherapy, and we did the Melissa test, and also we determined that there was also reaction to nickel, right? Nickel levels were high, and so we had immunotherapy given to reduce these levels, and chemical sensitivity went down, and for some time now this problem was being considered, but what will happen to the other hip? What will happen to his other hip? So we have certain limitations here because we cannot give intravenous therapy, we cannot give chelation, we cannot administer serum. And really, that's a big problem that we have here right now. We have these limitations. Our hands are tied. So we started another vaccine to start with sensitization. And when we spoke to the surgeons really frightened because he had multiple chemical sensitivity. And sometimes they get frightened, and sometimes they think you're a psychiatric case. So really you have this two negative reactions from the surgeons. So really our hands are tied, and the surgeons really did not want to take that risk because the doctor wasn't so familiar about this issue. So So my patient doesn't know what to do, whether he should undergo the surgical procedure in the other hip also. But we hope that if we get improvements with immunotherapy, then we might go ahead. But otherwise, he might have to go to the UK, for instance, to get an IV therapy. So really, what he doesn't know is whether he should have that surgical procedure on the other hip. But the other hip also produces a lot of pain. So now he has to decide whether he has to undergo that operation on the other hip and have another prosthesis on that side.
I'm sure it has, because usually you get things approved here faster than we do in America. But I would have a porcelain hip put in, porcelain fused on steel. And we found that that really cuts down the sensitivity, just as a porcelain tooth will cut down in the sensitivity. And I would not hesitate operating on him at all. We've done over 1,000 patients with chemical sensitivity now, very successfully. And he's sort of what I know about him, what little I know from your history and everything, he's an average case. And that can be designed, and if you can get a good surgeon who will listen, then you can do that. And some of the orthopedic surgeons are really starting to listen, and here the problem is because every orthopedic surgeon in a practice now, if they're honest, will tell you they've got 2 to 4 implant patients that are super sensitive and they can't do anything with, even though they put the prosthesis in. And we see this all around the country now. They seem to be quite malleable now on doing this. So if you look at the anesthetic very carefully, he could be done under spinal, and with like xylocaine or carbocaine or whatever he's not sensitive to, and wouldn't have to have all the other toxics. And if you have a cooperation of your anesthesiologist and do a porcelain hip, I wouldn't hesitate at all doing it.
Pero la prótesis de porcelana.
Perdón.
La prótesis de porcelana.
Sorry, porcelain hip, that's available in Spain, yes, for the hip prosthesis. The prosthesis is made of titanium. There's also another material, but I think titanium is the most appropriate. And for the patella, they have porcelain. But it's about 25 centimeters. And for the patellar part is made of porcelain. Let's see, once again, patellar part is porcelain. The stem is made of titanium. I had been admitted. I did not want to be operated on. I was admitted to hospital at night, and the following day I said, they told me that they didn't want to proceed with the operation. I didn't want to proceed with the operation. I spoke to Pilar, and we asked them to do allergy tests on me, and they were positive. And they said, well, we'll wait until October. In October, you'll be operated.
A comment. I think it's a absolute travesty. It's well, I think it's actually a human rights issue that you've not been able to get any intravenous therapy. You know, as Bill was saying, reducing your toxic load after being on the surgical table and having more sensitivities and such like would be absolutely essential, I think. And intravenous therapy, as Dr. Monroe's said, is a very valuable tool that you do have a right to, and I have no idea why that right has been taken away. And it's a shame that so many people have to come from Spain and travel to the UK and to Dallas and things to be treated when there's a doctor who's fully knowledgeable about these things and you can be treated here. So I'm really sorry about that. One more comment would be as well, you should try and, it's a bit on this side of things, but you should try earthing yourself as well. So making sure you've got contact with living things and you walk barefoot sometimes and such like, I think that probably might help a bit.
Hola, hola.
Right, I'm sorry. I'm sorry I can't stand up. Please excuse me for not standing up because I'll be too close to the lights. I am a patient of Dr. Munoz Calero. I'm here with you at this meeting thanks to her. I went to her center in a very terrible state. 1 month after seeing her, I was told that I had to remove the breast prosthesis because it was going to cost me my life. Little by little, I have recovered. I have trusted her completely. And because of her work, I'm here with you today. And she was always following me very closely, always concerned about my recovery. And since it was a bit slow, she thought that there was something wrong, that something wasn't going well. So she did several tests and consulted with other doctors, Dr. Gayan, and said that my problem might have to do with the presence, remnants of silicone in my organism, in my body. And so they will be doing other treatments now in order to improve. Now, the tests that were done recently, it has been shown that I have large amounts of formaldehyde. Well, I don't remember all of them right now. You see, um, toluene, yes. And I would like to take this opportunity to thank Dr. Pilar Munoz for everything she's done. And I'm really very grateful to her for her treatment, for this type of medicine that can save many lives. Now I have a question for the panelists and for her also. Large amounts of formaldehyde that I still have, I know I've heard that it can be neutralized, but if I cannot remove it from my body, what might happen? What will happen if I can't remove all of it? Thank you.
Yeah, well, you would be able to remove it. Was this a sensitivity to formaldehyde, or was it actually formaldehyde that she had?
Can't remember.
It must be a sensitivity.
Yeah.
So just do a neutralizing, and then you have to have all the antioxidants. It's a very simple molecule, HCHO. It should be metabolizable. We'll ask our friend here.
One thing about formaldehyde is a cross-linker of tissue, and it can cross-link tissue and then run. But you can neutralize for it, and I probably would, but I would neutralize for silicone also, because that may be a big part of your problem.
Ahora, le estaba preguntando.
Right. I was asking Dr. Rodriguez-Ferrer about this point. One thing has to do with neutralization. She already has had for vaccines. And I think it's 75 now, 75 different substances, different food. And she has improved. She has improved. Now, we have not advanced them too quickly. We have not administered serum. She tolerates this poorly, the supplementation per os. And it's rather complicated, much more complicated than with other patients. For several months, I have been administering a serum almost daily. She responded. She was practically dead when we saw her. She had toxic lipid syndrome, and she really had these breast implants that had to be removed because she also had heart problems. She developed pericarditis. It was really a very, very complex case, one of the most serious cases I've seen. And so very often I say that when we have MCS, one has to be very, very careful. We had one patient that had 25 neutralizing antigens, and after that treatment, after 6 months, she was able to carry out her normal daily life. She could do practically everything, whereas Mari Carmen has already on treatment for almost 2 years. 2 years, so it's practically it's very difficult. Um, so I think you should not compare cases. Each one is an individual case, Mari Carmen. And she also has problems with circulation, and it's rather deficient. It's necessary to give her vitamin C in large amounts. Dr. Ria, I think she will need also vitamin C for that problem, but she does not tolerate administration per os, oral administration. She cannot tolerate this supplementation. Now we're starting with another vaccine, and we have just received the results of the analysis, a sensitivity test, leukocyte assessment that was recommended by Dr. Gayal. We did fat tissue biopsy also to identify all the toxins, toxic substances, and also of pesticides, for instance. And Dr. Goyal came, and we were commenting on her case. And I really believe that with the new approach that we have right now, she will have a significant improvement.
I'm sure you won't mind me saying that you also suffer from hypermobility syndrome. So that's to do with basically you've got increased permeability of the gut. Now, about 40% of our patients, correct me if I'm wrong, Jean, have hypermobility syndrome and this increased permeability. And there's nerves of the autonomic system that are exposed in the gut and aren't functioning as well as they should. The immunotherapy should help with that, but again, this is a case where we have a person with poor absorption from the GI tract, we have confirmed mineral deficiency, and a huge need for nutrients, IV, not being given because of, I don't know what the law is that stopped it, because I can't really think of what that would be. And you know, I think that has delayed your recovery significantly. We'll still get there, okay, because some people can't afford IV therapy anyway, and you have to treat them without it, and you do get there, okay. So just, you know, we'll get there.
If anyone would like just to comment about hypermobility syndrome, I'll tell you about it. It's a condition which used to be called benign hypermobility syndrome. The other name for it is Ehlers-Danlos syndrome. And these people can touch the thumb to the wrist. They can, if you put your hand flat on the table, you can lift the little finger up to beyond 90 degrees. If you stand, the knee can be extended, it can go backwards a little bit. And if they can put the hands flat on the floor, with the palm flat on the floor. Now all of these bits don't need to have been done immediate, you know, now. It could have been in the past. There's one other actually. If you put your arm out sideways, the elbow bends upwards slightly. So the thing about this condition is that...
No, ella está...
Yes, she's been diagnosed as having Ehlers-Danlos syndrome.
The thing about it is that these are all the things to find, because it's very important to diagnose this when it occurs. There are other features of it where the skin is lax, or people can get varicose veins or prolapse very easily. There are a lot of different other features of it. But the point about it is that all of these people need food allergy management, because they all develop food sensitivities. And it's in the family, it runs in families, so anybody who's got this really ought to look at the others and get them treated and helped before they get very ill. So there we are.
Still, the most important thing is baja la carga corporal total.
Sí, en mi poca experiencia.
In my very short experience, I've seen several people, but I've a short experience. I've seen about 4 or 5 cases with Ehlers-Danlos syndrome. And Dr. Gayal has helped me diagnose them. And really, I was very surprised because I've already seen 4 or 5 cases of with MCS and Ehlers-Danlos syndrome. I have a question for Dr. Goyal in regard to autism spectrum. How does he interpret the fact that there are children with severe pathological condition and have MCS or metal intoxication and receive vaccine? Is that the cause of autism, or is that due to fragility or vulnerability of children, autistic children that have this underlying derangement already, that have emotional and psychological alterations, and that does predispose them to these disorders? And I would like also to ask all the health professionals to support the treatment of those that have MCS, to support that fully.
I think it's a really good question. The twin studies, the identical twin studies, were not 100% concordant. That means that if you have an identical twin with the exact same genetic material, they do not necessarily develop autism. So it's a heterogeneous group, it's a diverse group. Some of them will have genetic problems, but the most important aspect is probably an environmental factor of some kind, or factors. In my experience, over 80% will have toxicity, and about 50% will improve hugely when you start treating them. So what the exact toxin is, you can take your pick. We're surrounded by toxin all the time. So I think it depends on the vulnerability. I think Professor was talking about individual polymorphisms. And when you actually look at their polymorphisms through genetic tests, you will see that some of them have certain SNPs. Glutathione S transferase is gone, the COMT gene is gone, various other SNPs is gone. And I think it's a combination of what toxin and what vulnerability. And that's where you see the picture of it. Yeah.
Yeah, if I can comment on that. If you look at the various stressors that are reported to be involved in autism, they're all things that can initiate the no-no cycle. When you look at cycle elements in autism patients, all of them are elevated, every single one of them. That includes oxidative stress, it includes markers of peroxynitrite, it includes nitric oxide, it includes the inflammatory cytokines, it includes NF-kappa B, it includes BH4 depletion, it includes excessive NMDA activity. They're all elevated, every single one of them. And finally, it includes mitochondrial dysfunction. So the autism patients, according to and there's fairly extensive literature on all of these, have elevation of all of the elements of the cycle. So what I've argued is that autism is another no-no cycle disease, but that the difference with other things, including MCS and CFS and so forth, is simply that because it starts around the age of birth, that the impact on the developing nervous system is different. And that of course, that part of it, of course, is conventional wisdom. So there's nothing new about that. And the autism patients, of course, respond to various therapies that lower different parts of the cycle.
Sorry, Martin, I'll just add, some of the patients respond to it. I mean, it's not, the problem with autism is it's so diverse from, and you're right, you can give half of them B12, which is, I know, is a ono cycle scavenger, and they will have a sudden improvement when you do that, and I think you're trying to break the cycle there. But just, not all of them, it'd be my comment.
Well, they've been treated with BH4 in a series of published studies.
Well, some of them are the NMD receptor problem. I mean, normally you're getting things like agitation and hyperactivity and such like. And some of the kids, as my presentation before had showed, don't present that way. They present very sluggish. And in fact, what you're saying about the mitochondrial problem, sometimes you get someone with just a mitochondrial problem, and sometimes you get someone with NMDR problem. And I think it's just, it's a bugbear of mine that we do have to keep the individual focus alive, I think. Yeah.
Well, I think one of the issues about autism, and it's exactly the same issue with these other diseases, is they are very diverse. You have this whole autistic spectrum disorder, and the question is, how do you explain that? And the fact of the matter is that the no-no cycle not only explains it, it predicts it, simply because it's a primarily local mechanism. So you see variations in tissue distribution, you see variations in severity in different tissues. And that then leads to a tremendous amount of heterogeneity. And I think that, that it's very difficult to explain the heterogeneity. I mean, it's just stunning heterogeneity in any other way.
I would explain it through misdiagnosis.
I think the no cycle can be a consequence of some things, and in other cases it can be a cause. And so we've actually got to identify causes to eliminate those to reduce the effects of an upregulated no cycle. Or sometimes we have to just think we can't find the cause, so we've got to do something that will reduce peroxynitrite, like giving B12. So I think that really, honestly, we still have to look for causes and make it a very individual thing.
Let me just say, any vicious cycle is both cause and effect, by definition.
Sería bueno, os pregunto.
Right. Would sauna be useful for these children? Would sauna be useful for these children? Increasing BH4, would that be appropriate for children, giving them sauna?
Sauna is very appropriate for them. The question is, where can you get BH4? Let me know. I'd like a carload of it. I had one dramatic case of autism. This kid was about 5 years old. He could not talk at all. And he was sensitive to a few foods. And I hadn't seen him in 5 years. I don't know where they just disappeared. And I walked in, and before I realized he couldn't talk, I said, "What's the matter with you, kid?" And he said, "I'm a borderline autistic." So I asked the mother, I said, what have you been doing for this kid? And he said, well, it was, I did just exactly as you said. I eliminated the foods he was sensitive to. We had a room that was remodeled to be less polluted, and we gave him the drops for foods, and he got well.
Okay. The sulfate in autism is also a big problem, because we have often seen low levels in the serum or plasma of the sulfate, and at the same time increased levels of the sulfate in the urine. So if you have a low level in the serum, you lose a lot through the kidneys, and it's very difficult to recover. So your sulfation system is not working good at all.
Dr. Waring, I think Jean had referred to it earlier, found that 60% of autistic children had low serum sulfates. And it's quite dramatic, actually, the effect you can get from something simple as an Epsom salt bath. I mean, you're talking £10 for 15 kilos of it, and you put it in the bath. And her protocol just now is, I think it depends on the weight of the child, but I think it's about 250 grams, which is about 2 mugfuls of Epsom salts in the bath every night for 4 weeks, and then stop for 4 weeks, and then you might have to repeat it. And she thinks that can re-induce sulfation, but it's quite a dramatic thing. Yeah.
Well, I would like to ask a question.
Oh God.
We have a new process in America, and I think it's spreading to Europe. It's called fracking for natural gas. And the fracking agents are either hydrochloric acid or sulfuric acid. So patients are now coming in loaded with sulfuric acid and hydrochloric acid. So what is that going to do to these systems, and what are we supposed to do?
Hola. Hola, soy Yolanda. Tengo una niña que está diagnosticada.
Hello, I'm Yolanda.
Bueno, pero... ¿Qué?
Thanks for the help.
Is the sulfuric acid fat soluble? No.
Yeah, you can breathe it.
Yes.
Yeah, breathe it.
Can you bring it through intralipid?
We found it. We found the sulfuric acid and the hydrochloric acid in our breath analysis as number one.
From the natural gas?
From the fracking of the natural gas, that's correct. And the people who are living in this area, they're breathing it. Yeah, well, the pumps are sometimes right in their backyard, or right next. No, the pumps where they frack, and they harvest the gas, and it's sort of destroyed one whole area.
Well, I think probably using the quick intralipid thing would be one of the things to do, apart from using glutathione and other things.
Of course.
Yeah, but using intralipid quite quickly would be helpful.
Over an hour.
Como de forma rápida para poder...
Yes, that's a quick way of getting rid of these toxic agents, right? In one go. Yes, I think there's one more question here. There's a question from Yolanda. I'm Yolanda. I have a daughter that has an MCS. She's hospitalized, and also she's been diagnosed as having Ehlers-Danlos syndrome. And I would like to know, she has excess iron, I would like to know whether she can recover with immune therapy. And also I'd like to know whether Ehlers-Danlos syndrome will remain forever, or whether it can be cured.
Ehlers-Danlos is a genetic condition. It can't actually be cured, but the problems can be managed. So yes, she can have low-dose immunotherapy. In my opinion, is going to be essential for her. She needs to have the gut sealed because she will have increased intestinal permeability. And that's really something important that needs to be addressed. The most important thing, one of the other important things with Ehlers-Danlos is to try to avoid the multi-medicines that people get put on, because wherever they go, the doctors put them on medicines. So they go to see a chest specialist, they go to see a gastroenterologist, they go to see an ENT person, and they are put on every sort of drug, and then they're in real difficulties.
Did you say she had high iron? Yeah, she had high iron.
Serum.
That's always a severe problem. You can sometimes neutralize the iron, but the other thing you may have to do is occasionally, those patients, we have high irons, we have to take some blood from them. Depending on how big they are, you can calculate out how much to keep the iron in a normal level, because this does make a big difference in their clinical state. I have some patients like that, and I have one patient I know that gets bled every month for a little bit to get her iron low enough that she can function well, and she does. She goes all over the world.
El nivel de hierro de esta niña...
Iron level is measured through the erythrocytes, through the red blood cell elements. That's measured through the red blood cell elements. And I think that ferritin was normal, but it is high within the RBC's red blood cells. So she does not tolerate aluminum, nothing per os. She has already had 5 immunotherapy vaccines. Practically nothing can be taken orally. and we are trying to treat her, but she's also sensitive to caprylic acid. I don't know, to other citrus extract also. She cannot tolerate that also, and we are trying now to give this through suppositories. We have that from Breakspear, and we hope to be able to start chelation. Before starting chelation, I want, first of all, to determine whether she can tolerate these minerals, because once we start with chelation, that will take the minerals also, and that's very important because we cannot administer anything intravenously or through serum. We cannot administer anything through serum. And later on, we'll do analysis to determine the mineral level and start the chelation.
Es que por boca no quiere tomar nada. O sea, no. Su madre se desespera, pero no hay manera.
Yeah,
Point to the patient. There are a lot of people with Ehlers-Danlos syndrome completely well. They have no problems at all. Okay.
Yes, because
Maybe spectrum.
It's just the insult. It's the insult that gets them.
Bueno, yo creo que ya nos está diciendo.
Right, Raquel's telling me 3 more questions. Yes. Consuelo and Ana, 3 more questions. Yes, because it's rather late. I've already asked them this question many years ago, and I was fortunate to find the answer to my questions. I have MCS. I'm from Valencia. I was fortunate to find the doctors that identified this condition. They knew that I had something, but they said they didn't know exactly what it was. And they said, however, that they were going to study it. They helped me, and that was 10 years ago. I went to Dallas and stayed with Dr. Ria. I was treated for 6 months in Dallas. And what I learned there, I follow today. And those that have MCS, I can tell you that it's really very hard. But don't give up. Be constant. You will have a hard time, I assure you. But tell yourself that you're going to make it. You're going to make it. And when you have this crisis, you really feel bad, but continue fighting the following day. And I would like to thank Dr. Ria for his work, and Dr. Leone, who's not here, other doctors who are in Valencia. And I think this is a it's a big privilege for us to have this Congress. And I deeply appreciate it. And I would like to thank all of the speakers and the guest speakers, because this is really very beneficial to all of us.
Si no os importa, sé que hay dos.
Right, I think we have 2 other questions. Could you keep the questions for tomorrow? I promise you.